right, this is a continuation of task number 33, the discussion part of the IV catheter. And so, some complications that we run into with placing an IV catheter. First of all, the animal chews it out, major complication. Another one is extravasation, or for some reason the catheter slipped out of the vein, it wasn't placed properly, what have you. That can lead to sub-Q administration, which of course, propofol, other things that are irritant and actually irritating and can actually cause necrosis. That's a very bad thing. So major complications with that. Also, if you're running fluids, your fluids, dextrose would be a bad thing to go sub-Q. So those are some major complications. Also, swelling is certainly a major complication. So as far as things that you want to check for frequently, you want to make sure and check the distal and the proximal portion of the limb above and below the tape. You want to check the distal portion for temperature, swelling. Of course, if the paw is colder than the rest of the limb, it's not getting the circulation that it needs. There's also swelling above the tape. Again, your tape is too tight. Blood flow is not adequate to the distal portion of the limb. There's actually been times on bandages and things where we've seen some amputations as a result of that. So it's very important that you keep checking that, especially too if you're running fluids, they're going to start to accumulate and the tape is too tight. So definitely check for swelling above and below. You want to also check for patency of the IV catheter. If you have fluids, are the fluids still dripping? If not, you need to flush it. And of course, heparinized saline, the hep flush is a safe way to do that. Other things that we should talk about are precautions to reduce the chance of the animal chewing out the catheter. So if we kind of have a suspicion, almost always we'll wrap with vet wrap around that catheter, especially if it's something that we're not hooked up to a line with. We'll cover that up with vet wrap. Sometimes if you need to spray bitter apple spray, deterrents and things like that, you can do that over the vet wrap. But again, vet wrap, if it gets wet, it's going to shrink, so you got to check for that swelling. You also would want to place an e-collar or a comb. If they can't reach that catheter, they can't chew it out. So those are some precautions to prevent the animal from chewing out its catheter. And the last thing that we want to talk about is the concentration of heparin versus sterile saline. So in order to make a sterile flush solution, you want to inject 1 cc of heparin into a liter of sterile saline. Kind of rock that back and forth to mix that. But if you do it too concentrated, you're going to cause all sorts of coagulation issues. So 1 cc of hep per 1 ml of sterile saline. That concludes task 33.